We are back with Dr. Amy Thompson from Cone Health. She's answering all your questions about staying healthy through the holidays. So we just got done with Thanksgiving. Can you get your vaccine in time for Christmas, or is it too late now?
It's definitely not too late. Of course, you will get the most protection from the vaccine if you have gotten it earlier, kind of before you are in the position where you might get sick, but it's definitely not too late. It will take, a couple of weeks, a few weeks for you after you get vaccinated to really have your immune system build up that protection. So now would be a great time if you haven't yet, or you haven't finished all your vaccine series yet, to go ahead and get vaccinated for the upcoming holidays.
Can people get their COVID and flu shots at the same time?
Definitely. You could definitely get them both at the same time, one in one arm, one in the other arm. It's definitely not an issue. There was some information kind of when we were still learning about COVID that maybe you shouldn't do that, but new information's come out, that would be fine. If that's what it's going to take to get you to get the COVID and the flu shot, go ahead and get them at the same time.
What kind of reaction are people having to the booster shot? Is it making them sick?
So, if you get the booster for COVID, you probably would have similar symptoms to if you had gotten your primary vaccine series. So, most of the symptoms that people get after getting any kind of vaccination are usually mild. Your arm kind of might hurt. You might feel like you're starting to kind of get sick, but pop some Tylenol or some ibuprofen, and you should probably be all right.
So the booster for COVID helps tackle some of the big variants. Should we worry about any other variants of COVID in the future?
So there, is always more information coming out, and really that's why we have these bivalent boosters now. They can determine your protection against not only the kind of original COVID vaccine, or sorry, COVID virus that we saw, but now some of these variants. So as we learn more information about what's happening, they'll be able to kind of have better treatment options and maybe even better vaccines in the future.
Speaking of treatment options, people are wondering if they still have symptoms of COVID long after it's gone. What should they do?
Some of the things that we kind of are learning about long COVID or long haul COVID, you may have heard, we don't really know as much about yet. As long as you are kind of getting better, you can stop some of these isolation or kind of quarantining that's happening. You may have, symptoms of COVID that might last longer, and I've actually heard that if you have, reinfection with COVID, that kind of increases your risk of having those long haul kind of symptoms. But really, it's kind of as we learn more about things, we kind of put out more recommendations to help people not to get those symptoms later in the future.
You guys have a long haul COVID program at Cone Health, correct?
I'm not sure
Through
about that
treatment? Okay.
specifically. We have some treatments, and we have, offered both oral and IV forms of treatment for COVID. But long haul is something that's really being studied more.
Someone wants to say, I am a teacher. My students are coughing and sniffling almost all day long. I don't want to get a cold, but I don't want to wear a mask either. How can I be protected from their germs?
So some of the things that we have talked about kind of when the pandemic first started, if you don't want to wear a mask, try to keep your distance a little bit from some of your students. Wash your hands often and have them washing their hands. And really, if there is any possibility for doing kind of things outside, taking advantage of some of the nice weather that we might have, keeping some windows in your classroom open, maybe letting some of the air come in or spending more time outside. Those would be some ways that you could maybe decrease your risk of having COVID, even if you don't wear a mask. But I have to say, wearing a mask would be my recommendation.
What about the 6 feet, staying 6 feet apart? Is that still a thing?
That's still a thing. So 6 feet apart, or I've heard also 3 feet apart. Basically, if you can kind of socially distance from people, that would be a good thing.
And how long do you have to be exposed to someone with COVID before you could catch it? Like, if you're just standing next to someone in a store checkout line, is that dangerous?
Hmm. So the longer that you are exposed, or the closer that you are to someone that is, infectious, would be a higher risk of you actually catching COVID from them. So you could potentially catch it from someone that you're just kind of in a casual kind of contact with. But if you are in a close, tight space and you are with them for a longer period of time, that's going to increase your risk of getting COVID from them.